Welcome to this explainer. Navigating pregnancy is stressful enough as it is. Between agonizing over nursery colors, debating which car seat to buy, and, let's be real, surviving on pickles at 2 in the morning, you've already got so much on your plate. But for millions of expectant moms, there's this whole added layer of anxiety, managing a chronic condition like asthma while literally growing a tiny human. So today, we're zeroing in on an absolutely crucial question. Why does asthma demand daily proactive treatment during pregnancy? Let's dive right in.
It's usually the very first question expectant parents ask, right? Does pregnancy make my asthma worse? And the honest answer is, well, it's incredibly unpredictable. Historically, the rule of thumb was that a third get better, a third stay the same, and a third get worse. Kind of like flipping a weird three-sided coin. But recent data actually paints a slightly different picture. Studies have found that up to 40% of women experience worsened asthma control during their pregnancy.
And we're not talking about some super rare complication here. Asthma is actually the single most common chronic respiratory disorder that complicates pregnancy. It affects up to 10% of expectant mothers in the United States alone. That is a massive portion of the population suddenly trying to figure out how to breathe for two, all while dealing with compromised lungs.
But here is where we hit a pretty terrifying paradox. Despite how common asthma is, and despite the really severe risks involved, up to 50% of pregnant women with poorly controlled asthma don't use a daily controller inhaler. Nearly half, they're actively abandoning their daily therapies. And look, it's very often out of this deep, entirely understandable protective fear that the medication might somehow harm their baby.
That brings us to Section 1, the asthma pregnancy paradox.
So, why are so many expectant parents choosing to just endure asthma attacks rather than take their daily medication? As we just said, it's completely natural to want to avoid medications during pregnancy. That fierce maternal instinct kicks in from day one. But here's the reality check. Avoiding treatment actually guarantees dangerous asthma flare-ups. Because of this totally understandable hesitancy, up to 40% of pregnant women report having an asthma exacerbation in the past year, and almost 20% experience an attack severe enough to require actual medical intervention. By trying to protect the baby and skipping the inhaler, you're actually putting both mother and child directly in the path of a medical emergency.
Moving on to Section 2, let's talk about breathing changes during pregnancy. To really grasp why asthma is just so dangerous during gestation, we have to look at the physiological reality. Even without asthma, a pregnant body fundamentally changes how it breathes. Have you ever heard a pregnant woman say she just can't catch her breath? That is entirely normal. It's actually called physiologic dyspnea of pregnancy, and it affects up to 70% of women. As the uterus grows, it literally pushes the diaphragm up by about 5 centimeters. That reduces your resting lung volumes. Plus, the hormone progesterone totally surges, basically telling your brain to increase the depth of every single breath so you can offload carbon dioxide for the fetus. So how on earth do we tell the difference between normal pregnancy changes and a dangerous asthma attack? Well, physiologic dyspnea is just an isolated sensation of breathlessness. You feel winded, sure, but you can still move air. Asthma, on the other hand, is obstructive. It comes with wheezing, a really tight chest, coughing, and crucially, it responds to a rescue inhaler. It is absolutely vital for parents to know this distinction, so you know exactly when it's time to worry. Take a look at this flow volume loop we have here. See that blue line? That represents normal breathing, or normal pregnancy breathing. Notice how wide and open that loop is? Now look at the restricted red line. That represents asthma. See how it's all scooped out and restricted? Asthma actively narrows the airways and literally traps air inside the lungs. When a pregnant body is already working overtime, fighting against a compressed diaphragm just to exhale carbon dioxide for the baby, adding that airway obstruction, it's a recipe for disaster.
Let's move to Section 3, risks to mother and baby.
Which leads us to the hard medical facts. What actually happens when asthma goes untreated? The most crucial thing to understand here is that maternal breathing and fetal oxygenation are directly linked. They are a package deal. On the maternal side, untreated asthma dramatically increases the risks of preeclampsia, preterm labor, and requiring a C-section. And on the fetal side, we see much higher rates of low birth weight, neonatal respiratory distress, and even an increased risk that the child will develop early-onset asthma themselves. The inflammation and those sudden drops in oxygen take a huge systemic toll on the entire pregnancy.
And look, we have to acknowledge the absolute highest stakes of ignoring asthma control. If a mother has a severe asthma attack and her oxygen levels drop, a state known in the medical world as severe maternal hypoxia, it directly threatens the baby's life. The clinical literature on this is crystal clear. This can cause devastating fetal harm, up to and including neonatal death and ischemic brain injury. This isn't just about avoiding an annoying cough, right? It's literally about protecting the baby's developing brain.
Okay, taking a breath here. Let's move to Section 4, the daily treatment defense.
Let's pivot away from those frightening risks and talk about the empowering solution, because we actually have an incredibly effective shield to protect the pregnancy. But first, let's just tackle that main anxiety head-on. Is it actually safe to use daily asthma inhalers while pregnant? I mean, when you read the warning insert on any medication, it sounds terrifying, right? But I promise you, the clinical data on asthma inhalers in pregnancy is overwhelmingly reassuring.
The American College of Obstetricians and Gynecologists, they set the gold standard here. Their clinical guidelines are explicit. They state, clinicians should actively discourage discontinuation or de-escalation of asthma therapies during pregnancy. The medical consensus is absolute on this. Do not stop your asthma medication when you get pregnant. The risks of the untreated disease are just infinitely higher than any theoretical risk from the treatment itself.
In fact, routine daily use of inhaled corticosteroids, which are basically the backbone of modern asthma treatment, can reduce the risk of a dangerous asthma exacerbation in pregnancy by more than 75%. Just think about that. By simply taking a daily preventative inhaler, you wipe out 3/4 of the risk of ending up in the emergency room fighting for breath. It is a total game changer.
To build this defense, doctors use a highly structured evidence-based algorithm. Now, don't worry, you absolutely do not need to memorize every single step you're seeing here. Just notice that it relies heavily on inhaled corticosteroids, or ICS, often combined with a rapid-onset bronchodilator like formoterol. Depending on your specific symptoms, your doctor will step up or step down your daily dose. The goal is to ensure you are getting exactly the right amount of medication to keep those airways wide open without ever over-medicating.
So if you take nothing else away from this explainer, remember this core takeaway. Daily inhaled corticosteroids are not a burden, and they are certainly not a danger to your baby. They are a proven, safe, and absolute necessity. They safely reduce symptoms, they prevent those terrifying exacerbations we talked about, and studies show they actively lower the risk of preterm delivery. Daily treatment is exactly how you protect your pregnancy.
Finally, let's cover Section 5, handling asthma emergencies.
Now, even with the absolute best daily management, we still live in the real world. Respiratory viruses happen, unexpected triggers pop up. Especially in the second trimester, asthma emergencies can still occur. If you or your partner are pregnant and have asthma, you need to literally memorize these warning signs. If you are having difficulty speaking in full sentences, if your breathing is visibly labored, like you're having to use your neck or rib muscles just to breathe, or if you have what we call a quiet chest, meaning you don't even hear wheezing anymore because so little air is moving, that is an immediate medical emergency. Do not wait. You need emergency intervention and likely systemic corticosteroids to force those airways back open.
And when you get to the hospital, advocate for this specific number, 95%. In an emergency, doctors aim to keep an expectant mother's oxygen saturation above 95%. This is actually a stricter, higher target than they use for non-pregnant adults. Why? Because that extra buffer is absolutely required to ensure that oxygen successfully crosses the placenta and keeps the baby perfectly oxygenated while the doctors are busy treating the mother's lungs.
We've seen the very real risks of untreated asthma, and we've seen how incredibly effective and safe daily inhalers really are. So the question isn't just whether you have your hospital bag packed by the door. If you are expecting and you have asthma, please do not wait for an attack. Speak with your doctor today about getting a proactive daily asthma management plan in place. Are your lungs ready to breathe for two? Because at the end of the day, breath is the one thing your baby literally cannot take without you.